The meningitis vaccination campaign launched in Nigeria aims to reach 3 million people. An epidemic is underway in the northern part of the country. Together with the Nigerian Health Ministry, MSF teams are vaccinating people between the ages of 2 and 30 years old in the areas most at risk. Mass vaccination will reduce the number of new patients within 2 weeks. The situation in this densely populated country is of great concern. 700 people have died in the 9 northern states most affected by the epidemic. More than 20,000 suspected cases have been reported.
We classify our patients according to their ages. So in patients that are above 2 years of age, we want to look out for general symptoms of headache and neck stiffness with or with particular rash on the trunk and on the face. Now in patients that are less than 2 years of age, we want to look for fever as measured with a thermometer of above 38.5 degrees centigrade, as well as other neurologic signs like hypotonia, like bulging fontanelle, like seizures, like general flaccidity.
Left untreated, bacterial meningitis kills up to half of infected patients. Most cases can be cured with a single dose of antibiotics, which must be given immediately once symptoms appear. The majority of deaths occur within the first 48 hours. The epidemic is also affecting other West African countries. MSF is vaccinating in 3 areas of Niger, reaching more than 1.5 million people. The number of cases is also rising in Burkina Faso, Chad and Cameroon. Teams are evaluating the situation and are ready to vaccinate if necessary. Médecins Sans Frontières staff were released after 3 days in captivity. On March the 11th, 4 MSF members were kidnapped in Serif Umra in North Darfur. The kidnapping occurred shortly after 13 NGOs, including MSF, were expelled from Darfur. The MSF expulsion targeted the Dutch and French sections, 2 of the 5 sections working in the region. The Sudanese authorities' decision came following the International Criminal Court's warrant for the arrest of Sudanese President Omar al-Bashir for war crimes and crimes against humanity in Darfur. MSF has withdrawn its international teams for now. The sections that were not expelled are still in talks with the Sudanese authorities in Khartoum in the hope of continuing the medical projects underway in the Darfur region. Filmed in Vavunya in northern Sri Lanka, these images show just one of the 15 displaced persons camps in what is referred to as a transit zone. Nearly 60,000 displaced people are living here, 80 kilometers from the front line. On the other side, in the Vani region, 100,000 to 150,000 people remain trapped amidst the fighting between the Sri Lankan army and Tamil Tiger rebels. Caught in an enclave of barely 20 square kilometers and subject to continuous bombing, they receive almost no aid. The explanation is simple. Last September, all international NGOs, with the exception of the International Committee of the Red Cross, were expelled from the region.
The main needs are needs of medicines, needs for water supply, needs for sanitation system. For this population, totally isolated and caught in the crossfire. But the main problem is to withdraw those people from the conflict areas, and there is few chances for them to escape at this time.
Since February 2009, ICRC teams have managed to evacuate 7,500 people. In the Vavunya hospital, MSF teams perform nearly 200 operations every week, mostly on patients with gunshot or shrapnel wounds. Many others remain trapped in the conflict zone, to which MSF is still denied access by the Sri Lankan government. The cholera epidemic is still on the rise in Harare, the capital of Zimbabwe, and the surrounding areas. The drinking water supply system rarely functions here, and wastewater flows directly into the street. Tens of thousands of families are exposed to conditions that promote the spread of cholera. This contagious disease triggers diarrhea and vomiting, leading to severe dehydration that can be fatal within hours. Treated promptly with intravenous rehydration, the patient can recover quickly.
So this is an example of a family. The father and the whole family came in yesterday. It was the whole family that got infected, and we often see that. Not all of them necessarily as severe, but when they drink from the same source or they have an infected person, then of course the infection from one person to the other is a very, very high risk in very poor hygienic situations.
To stem the epidemic, MSF teams are disinfecting water from wells with chlorine and have stepped up hygiene education. The epidemic has taken a heavy toll since it began last August. According to the World Health Organization, 4,000 people have died and more than 89,000 have been infected. Mobile teams and dozens of cholera treatment centres set up by MSF have treated 56,000 patients across the country. On April the 1st, the countries most affected by multidrug-resistant tuberculosis, India, China and Russia, met in Beijing. MSF asked them to commit to treating more patients and to conduct the research crucial to finding improved treatments. This form of tuberculosis, MDR-TB, is caused by bacteria resistant to at least two of the most effective anti-tuberculosis drugs, isoniazid and rifampicin. Treatment is complex, and the drug regimen is long and toxic. But recovery is possible if the patient is treated. 74 MSF patients in Zugdidi in Georgia and Sukhumi in Abkhazia have completed treatment. However, they must wait 2 years without relapse to be considered cured.
I felt very weak when I was on treatment. I got tired very quickly, even walking 500 meters. Now I feel as strong as I was before I got sick. I even managed to climb up onto the roof and repair it. And now I can drive again. I went all the way to Senaki, Tbilisi.
There are an estimated 500,000 new cases of tuberculosis every year. According to the World Health Organization, in 2008, less than 30,000 were diagnosed. Barely 3,600 people received treatment with drugs of quality.